Hello, good morning, and thanks for keeping a day with us on Health Business. Our business on Health Business is helping you keep tab on the health sector, as well as helping you get the best as regards your health. I'm your host, Oluwatoyin Kolawole. First on the lineup is the news segment. Don't go away. And nice to know you are still watching Health Business. Recently, Nigeria joined the rest of the world to commemorate this year's World Mental Health Day. A purpose-built private mental hospital based in Ikorodu area of Lagos State organized a mental awareness and free screening for the residents of the area. Health Business was at the screening.
The World Mental Health Day, according to the World Health Organization, is marked with the overall objective of raising awareness about mental health issues around the world. It is also set aside to mobilize effort in support for mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what needs to be done to make mental health care a reality for people worldwide. There are still lots of myths and misconceptions surrounding psychiatric illnesses in Africa, especially in Nigeria. Many people continually refuse to take their relatives with mental health challenges to the hospital for treatment because they believe psychiatric illnesses always have a spiritual undertone. Majority also take neuropsychiatric hospitals as their last resort, especially when the case appears to be out of hand. With this year's theme as mental health in the workplace, experts noted that mental health problems at work are common. At least 1 in 6 workers is experiencing common mental health problems, including anxiety and depression. In line with the World Health Organization objectives, the Chief Executive Officer of the retreat, Dr. Olufemi Oluwatayo, says it is important to create a mental health awareness and free screening to add value to mental services in Nigeria.
I think there's a lot to be done in terms of work, in terms of mental health care in Nigeria. A lot of our colleagues are doing a great job. We have, like in Lagos, it's a city of 20 million people and over. So you can imagine the amount of people that needs help. So I think there's a lot going on already. If you go to Lasut, if you go to neuropsychiatric hospital Yaba in Lagos. So I think there's a need to add more to that. So the independent sector should provide more. So that's where the retreat comes in to complement what the government is doing. So there's a lot of need. So I will encourage my colleagues to do more and help people with mental health needs.
Dr. Oluwatayo noted that mental health is still a taboo in Nigeria and many people feel scared and confused to talk about it.
It's good to go and pray about it and go to the church, but we need to do a bit more as well, get some treatment as well.
What are the challenges mental health care workers face in rendering their services?
The care of the psychiatric patient is an enormous task and it involves a lot of personnel. I mean trained professionals, not the psychiatric nurses alone. We have the consultants, psychiatrists, we have clinical psychologists, we have the occupational therapists, and so on and so forth.
The expert also used the opportunity to call on employers of labor to ensure a conducive environment to their employees, pay their salaries as at when due. They noted that many employers and organizations do not see issues of mental health at the workplace as priority. Hence, many employees may be suffering in silence.
In the month of November, pharmacists from all over the country and beyond gather in the chosen states for their annual national conference. This year, the chosen state is Abia State. From Monday 6th to Saturday 11th November 2017 at the Multipurpose International Conference Center, Umuahia. And the very apt theme of this year's conference is Medicines, Availability and National Security. The keynote address will be delivered by Dr. Andrew Nevin, Chief Economist, Price Waterhouse Coopers, an erudite scholar with vast experience in international business development and policy formulation. The conference theme will be discussed under 3 broad perspectives: regulatory, social, enterprise, and business. The conference promises to be a combination of learning, relaxation, business, and networking with various segments, including the star-studded opening ceremony, plenary sessions, exhibition, excursion, and poster presentations. The conference will showcase the rich culture of Abia State, including the War Museum, Azumiri Blue River, and the Ngodo Caves. The event will be capped off with colorful closing banquets. The PSN President Pharmacist Ahmed Yakasai and Governor of Abia State, Dr. Okezie Ikpeazu, look forward to receiving you.
Historical accounts establish that the practice of preparing medicines and dispensing same, otherwise known as pharmacy, is the oldest profession in the world. Such accounts further claim that it is from this profession that other medical fields such as medicines, nursing, and lab sciences originated. In 1887, the European-style pharmacy was introduced in Nigeria, and this brought about the enactment of Drug and Poisons Ordinance of Lagos Colony in 1902. In 1923, the Association of Nigerian Dispensers was formed, and subsequently in 1923, the Poisons and Pharmacy Act was also enacted. In 1927, the School of Pharmacy in Yaba, Lagos was formed, and in 1930, the Pharmaceutical Society of Nigeria was formed. In 1956, it was recognized by the law as a professional society in Nigeria by the federal government. Since then, the Pharmaceutical Society of Nigeria organizes a national conference every year to address the achievements and challenges of the association and profession in the country. So, what form is this year's conference going to take? The Central Planning Committee Chairman, Lulu Ujo, let us in on the plans for this year's event.
For us as pharmacists, whether you are in the hospital, you are in the community, you are in the academia, or you are in the industry, we want everybody to be conscious of what their roles are in making drugs available, particularly to those communities that may not be as privileged as those who live in the urban cities.
What is this year's conference tends to achieve?
We are doing something to reach out to unserved community apart from medicine availability, and one of the big features of this conference is that we are going to be impacting a community not far away from the capital who has never seen an organized medical facility. So we take the medical facility to them by using a mobile clinic and making sure that everybody involved in the healthcare system is there. The doctors, the nurses, the laboratory, the pharmacists, and we take their drugs there. And we hope that we'll be able to serve about 500 people so that their immediate need can be taken care of.
How will the public benefit from the outcome of this conference?
We will have medicines available as needed at the time that is needed. That's one. Two, the upsurge or the increased tempo of activity in local drug production will mean that more people will be employed. So it will create more employment for people. Then again, if we are able to rationalize or sanitize distribution of drugs, then our people can buy their drugs with some measure of confidence that they are buying the right thing, and will remain healthy.
All roads lead to Umuahia, the capital of Abia State, for the 90th Annual National Conference of the Pharmaceutical Society of Nigeria.
In the month of November, pharmacists from all over the country and beyond gather in the chosen states for their annual national conference. This year, the chosen state is Abia State. From Monday 6th to Saturday 11th November 2017 at the Multipurpose International Conference Center, Umuahia. And the very apt theme of this year's conference is Medicines Availability and National Security. The keynote address will be delivered by Dr. Andrew Nevin, Chief Economist, Price Waterhouse Coopers, an erudite scholar with vast experience in international business development and policy formulation. The conference theme will be discussed under three broad perspectives: regulatory, social enterprise, and business. The conference promises to be a combination of learning, relaxation, business, and networking with various segments including the star-studded opening ceremony, plenary sessions, exhibition, excursion, and poster presentations. The conference will showcase the rich culture of Abia State, including the War Museum, Azumiri Blue River, and the Ngodo Caves. The event will be capped off with colorful closing banquets. The PSN President Pharmacist Ahmed Yakasai and Governor of Abia State, Dr. Okezie Ikpeazu, look forward to receiving you.
Nice to know you are still watching Health Business. Next on our line-up is Understanding Infertility with Dr. Abayomi Ajayi.
Welcome to Understanding Infertility. My name is Dr. Abayomi Ajayi, and today we're going to be discussing something very interesting: male infertility. How can we treat when the sperm parameters are not at par? We can look at this from 3 different views: drugs, surgery, and assisted conception. For the drugs, well, unfortunately, as of now, there's still no sperm boosters. So when the sperm count is really low, then drugs, as of now, cannot really help. When the sperm count is low or not there at all, the only thing that is proven to give remedy is assisted conception. And you know, the first assisted conception was what we call IVF, and that's why up to now we still call everything IVF under assisted conception. But we know that there are so many spin-offs of IVF, and one of them for male infertility is what we call ICSI, or intracytoplasmic sperm injection. What this simply means is that we just take one sperm and we inject it into one egg. This is of course done under very high magnification and requires a lot of skills from the people who are doing it, the embryologists. So this is where actually the rubber meets the road, where you need the skill of the clinic to be able to do this. From 2004, other things like IMSI, which is an advancement on ICSI, have also been introduced. What this also means is that in ICSI, what we do, you know, I told you we magnify the sperm to times 200 or times 400, but in IMSI, we actually magnify to about times 7,000. So we are able to see all the various parts of the sperm. And one frightening thing that we saw was that a lot of the sperm had holes in their heads, which are not normal sperm, which we should not use for fertilization. And that was why when we were started with ICSI, we were beginning to fertilize a lot of eggs, but we were also having a lot of miscarriages because we were just simply using sperm that normally we not fertilize to fertilize the eggs. But with IMSI, we're able to pick and choose the ones that are normal and the ones that are not normal. Sometimes there's some things that you can do to prevent having low sperm count. If you have not already had it, there's some things that you can do to prevent it or to preserve your fertility as a man. But what we say most of the time is that diet, you eat healthily, make sure that you maintain a normal BMI or body mass index, not to talk of hard drugs. Excessive alcohol also depresses sperm count. Caffeine should be limited to not more than 2 cups per day. Anabolic steroids, that is the drugs that people use when they want to develop six-pack, definitely destroys the warehouse of the factory for producing semen. One other thing that people ask all the time is about this underwear, the controversy between boxers and pants. Yeah, boxers are better, no doubt, but does not mean that because you're wearing boxers, you can't have male fertility. Like I said, the only thing is that you must do tests to find out whether there's an issue or not. I think that's what we're going to round up today. We'll see you next time. Remember, together we can conquer infertility. My name is still Dr. Abayomi Ajayi. Catch you.
You're still watching Health Business, and this is Understanding Infertility. And this segment is called Doctor Explain This with Dr. Abayomi Ajayi. We have so many questions concerning infertility and lifestyle. Dr. Abayomi, you're welcome on the program. Well, this morning, as usual, we have lots of questions, but we'll take them one after the other. Peter sent this from Delta State. He is curious to know if smoking and drinking can affect or cause infertility in men.
Sure. It's that's well documented that both excessive alcohol and smoking will reduce sperm count in men. But that's not even only for men. The two also affect women. So as much as possible, when you're facing the challenge of infertility, it's better you, if possible, give up alcohol completely, if possible, or reduce your alcohol intake. But smoking is a no. It affects the two, both man and woman. So yeah, I think it's better for him to give it up if he's...
Okay. Etim sent this from Bayelsa. He said he's a baker while his wife is a makeup artist. He wants to know if their job is a contributing factor to their infertility.
Well, I guess bakery, well, you know that the testes, I mean, it depends on what kind of, you know, the old bakeries where they used to have furnaces for oven, that might definitely affect affectility, because we know that we always say that men should try to keep it cool when it comes to the areas of the testes. And if there's a furnace, definitely it's going to hit every part of you. Depends on how long you now spend in such areas. Yeah, definitely could affect fertility. So maybe, but it's something that to consider. It could be a contributory factor. For the beautician or the makeup artist, I don't think there's anything. I don't know so much about makeup, but I don't think there's anything that is toxic that they expose themselves to.
Sheung asks if there is a non-medical approaches such as relaxation or medical techniques that can improve on our chances of getting pregnant.
Sure, we're getting more and more into this thing of relaxation techniques now, that because there is a component of infertility. It's like the story of the chicken and the egg. We don't know which came first. It's the stress and infertility. Whether it's stress that came first before infertility, or it's infertility that came before. But we know there's a relationship between stress and infertility. And therefore, things that could take away stress, like she said, for example, yoga, you know, acupuncture, there are things that might encourage, and then also known to, especially something like acupuncture, increases the natural endorphins, the happy hormone. So there are things that might contribute to conception. But that's if there is no real problem. For example, if your tubes are blocked, then you need to have treatment. If sperm count is not good. So basically, the first thing to do is always to have a good assessment before you start looking at some other things.
Patient says she has been married for 2 years. She says she works in an aviation company. She wants to know if it's important to get a fertility evaluation done now, or she can wait a little bit longer.
Well, when she didn't give us her age, you know, but one thing we always say is that when infertility is trying after 1 year of regular unprotected intercourse. So I think she qualifies to have a good assessment to start with.
Moving on to our last question now. Bayo sent this from Lagos. He said, looking at the economic situation in Nigeria, will you say recession is responsible for some young couples not getting children on time?
Well, probably, because, you know, we just mentioned about stress and infertility, where if maybe the economic situation might stress, but that's a fine print. It's a very fine print. Like, you know, the two commonest reasons why people don't get pregnant in this environment is sperm count being deranged and tuber blockage. So those are the main giants in the causes of infertility. So things like stress are just footnotes. So I won't say recession is, except if it affects some other things. I'm just joking anyway. So I think, no, that would be far-fetched.
Thank you so much, Dr. Ajayi, for being part of the program this morning.
My pleasure.
That's our package on health business this morning. Join me again next week for a fresh installment. My name is Oluwatoyin Kolaole. Remember, living healthy is a serious business. Bye for now. Thank you.